Hello and welcome back to the WellFit podcast. I am here joined by special guest Dr. Chris Cordero, and today we are going to talk about physical therapy, injuries, training with injuries, training around injuries, preventative injuries, and all sorts of good stuff. So, Chris, could you please tell us a little bit about yourself and what physical therapy is?
What's up, Ben? Thanks for the introduction. My name is Dr. Chris Cordero, and for those who don't know, Ben and I work at H&H Fitness in Oradell, and if our schedules align, once in a while we'll get a workout session in, and he kicks my ass, and I can't walk for a couple days or work, so I appreciate it. He's a wealth of knowledge.
Oh, thank you.
But yeah, so I'm a doctor of physical therapy. I am also a board-certified orthopedic clinical specialist. And I just passed that in May of last year, and it was a tough exam. It was basically the physical therapy board's exam all over again, but specific to orthopedics. And I just always wanted to challenge myself. I started interest in physical therapy probably like a lot of physical therapists out there that I was always into athletics. I played soccer mostly, but I also played some baseball, a little lacrosse. And in I went to Bergen Catholic in Oradell, and I got injured my junior year, and it was an ankle sprain that just kept spraining, and I didn't quite take care of it. I didn't go to physical therapy. I didn't do what I was supposed to do. And then and then eventually, I think all it took was like a little pass, and my ankle went the wrong way and fractured. But then I went to physical therapy, and then I got better, and I finally found out what this was all about. And going through, I went to Seton Hall for undergrad and grad school, and going through that process as I got closer to beginning grad school, and then towards the end, taking boards, I kept falling more and more in love with physical therapy and the interactions you have with your patients and clients. And, it just was a really lucky fit that I wound up finding what I love to do. And just the fact that you can get people better using your mind and your hands and not, relying on, anything else, and really trying to address the root cause of the injury and not just, masking it with medication or, just slapping ice on it and, hoping for the best. So yeah, that's kind of what got me into physical therapy.
Awesome.
Yeah.
So, just kind of something that I realized the other day, too, was do you have to spend a lot of time doing paperwork?
We do. That's the fault of the damn insurances, but
yeah.
So
that's probably the only downside to what you do.
I mean, obviously the better you get at it, the quicker it goes, but it's definitely something that it's time consuming. You don't get paid extra for doing documentation. You either finish it within your shift or you don't, and you don't get paid for overtime doing documentation. It's good and bad because it's the one good aspect is that you should be documenting what you're doing because you can you're tracking exactly what's going on with the patient, and it just puts a little more of a scientific spin on it, if you will. But yeah, it's not I don't know many physical therapists that sign up for our job to do documentation.
Yeah. I just remember that recently. I think I saw something online where someone was saying the amount of time that they spend doing paperwork is the worst part. But especially when you get into when you like the hands-on stuff, then you got to fill all that stuff up. But it's important.
Exactly.
You got to document just like anything. So for insurance purposes and all that good stuff. In PT, what is the most common injury that you see?
Where I work, we see everything because we're an orthopedic clinic, but we also see a lot of neurological cases. We are a hospital-based outpatient center, so that's why we get that broad range of patients. But I still would have to say that low back pain is the most common, and it's definitely still the most commonly prescribed injury out there, and mishandled, I would say. And it's interesting because as low back pain or patients with low back pain are increasing, we're not doing as a healthcare field, we're just not doing well with taking care of it. And I think it just starts on, patient education and what kind of information are the patients getting as soon as they get that back pain. Who is the first person they're going to, and what is that first, physician or clinician, what are they telling them? And I think that's where we're failing, because there's a lot of misinformation out there. There's a lot of overprescription of medications, and but I think in PT it seems to help.
For sure. So I mean, I have low back pain. I don't know too many people who don't have low back pain, but those who end up going to physical therapy, what they come away with a lot of the times is strengthen your core. That is like the main thing that everyone always says, strengthen your core. And then a lot of people struggle, like, well, how the heck do I strengthen my core when my back hurts? Like, what exercise am I supposed to do? How can I do that? What is your kind of, because I'm sure that gets addressed with you and you try to strengthen your core. So what are some of the main things that you prescribe people to do to strengthen their core, and what is the core, and how does that help heal the low back?
Right. So your core is basically everything from your neck to your pelvis and everything in between. A lot of people mistake the core as just your abdominal muscles, and I think that if they're misinformed as to exactly what the core is, that they'll misuse it. So what I try to do first of all is their core weak? Most people do have a weak core, but it's not everyone. Some people happen to, rarely, but some people do show up with strong cores. But first of all, I'm trying to figure out what is their ability. Are they an athlete? Are they an older individual? What kind of activities are they going to have to do? Are they a new father who's in their mid-30s and has to pick up their child off the ground, or do they just have to get off the toilet and then walk over to the kitchen and then to the living room? So it all depends on what their abilities are and what their goals are and their prognosis. But I would say that you have to, even in someone who's very athletic, I've seen a lot of high school football players that come in and they're jacked, they're massive, they're fantastic on the football field and all that, but you ask them to just contract their core or do a simple pelvic tilt, and they cannot fathom how to do it. So that's the one thing I would say is no matter how strong someone looks or how big they are, you can't just assume that they know how to do it. So I always try to start with the very basics. So just something as simple as lying on your back with your knees bent, feet flat on the mat, and learning how to draw in your core. So some people will say pull your belly button towards your spine. Some people will say that it's that sensation where you're holding back your urine. What I try to tell people is the muscles that we're trying to contract are these deep muscles that wrap around your spine 360. So the better you get at contracting your core, the more you'll be able to stabilize the entire spine from the front, back, and sides and underneath from the pelvis. So we start with those simple positions and then progress it to harder positions, bird dogs, squats, deadlifts, as we progress, and if that's, in their wheelhouse, and we go from there. So
cool. So just because I'm thinking of it, because you mentioned it, squats and deadlifts are in the in the general world. When people hear that and they think about low back injury, they're like, no. They're like, I don't want to squat, I don't want to deadlift because I don't want to hurt my back, or I can't squat, I can't deadlift because I have a bad back. What is your approach to that? How do you feel about squats and deadlifts, pretty much?
Well, what I would explain to them is a squat is something that you do every single day. So when you get up from a chair or you go to sit down to your couch or to the toilet or whatever, you're squatting. You're essentially squatting. And then with regards to deadlifting, although most people don't do it properly, you're deadlifting all day long. You're bending down to the ground to tie your shoes to pick up either something light or something heavy, a box. So that's kind of where I start and kind of explain that the movements are, if you've never done a squat or a deadlift before in the gym, I wouldn't load you up with, 245s on a bar. But I would have you start, and again, going back to those progressions, start with just some simple sit to stands, which is one of the most popular physical therapy exercises. But like anything, there's a right and wrong way of doing it. And, depending on what they're doing wrong or where their, inflexibilities are, their weaknesses are, you can start to kind of piece together where they might be having their difficulties. But yeah, it's a lot of my patients, I really try to push them to do deadlift variations and squat variations, lunge variations. And it's a hard sell in the beginning, but once you kind of break it down and explain to them that these are natural movements, and I'm not trying to, blow your back out, that would not help business at all. So,
or maybe it would, because it's,
or maybe it would. Right? Yeah.
It's all a trap. It's a circle.
Exactly.
All right, cool. So, just one more thing on that note. And you don't have to say yes or no if you have your own kind of version of this, but are you someone who believes that, like, the weights don't hurt somebody and it's more of the way that they move the weights? Or do you disagree with that kind of moment? It's like how you do it versus, like, the amount of weight. Some people are like, that's too heavy, you're going to hurt yourself. I mean, people say that to me all the time kind of thing. Yeah. So what's your opinion on it? I mean, it's totally cool if you think it that way.
Right.
I'm just curious what your approach is.
I mean, it's definitely a complicated question and answer, because there's really no right or wrong answer when it comes to this. You could look at it in many different ways. One aspect is, if you're, let's say, going back to the core, if your core is not strong enough, if you cannot stabilize in a plank, or if you cannot stabilize just getting up from a chair, then loading you up with a ton of weight is not the right approach. Eventually, if we build to that, I'm all for loading, and I think a lot of physical therapists in particular do not load their patients properly. So that's definitely one thing that I would say, and I really try to, it's different when you're dealing with someone with an injury, but they still can take, the back is it's a very strong structure in our body. There's so many muscles and ligaments that cross at all the different junctures of the vertebrae, and I think people they just don't realize how strong the back is. That being said, I think if you're someone who is misproperly lifting the weights, or maybe you're lifting them correctly, but you're not giving yourself a proper chance to recover, you're not doing proper conditioning, there could be that cumulative effect where you're doing good exercises, you're doing good movement, but all of that load added over time it can eventually maybe cause some stress in your back. But going to that point, I always tell my patients that take the example of a marathon runner and a sedentary person, same age, take an MRI of both their knees, and they both have the same type of breakdown in their knee, meniscus tears, arthritis. But one is a marathon runner and one is sedentary. So kind of, which life would you rather choose? Would you rather get hurt working out and exercising and, helping your brain, your heart, your lungs, or would you rather sit on the couch and just wait for gravity to destroy your joints?
Okay, yeah. I hope everyone chooses. Well, maybe not marathon, because that doesn't appeal to me too much. But yeah, awesome. I had I recently was I came in to work and I was like, you know what? I was telling my manager Jerome, I was like, hey, you do. He's a 5-time Ironman. I'm like, Ironman would be a cool thing to do, like as a fitness person. I was like, how long is the run? And he goes, well, the run's a marathon. And I said, you gotta be kidding me. Just the run is a marathon? And then I gotta swim, because swimming was what I was nervous about, and I think it's 5 miles. Probably. And I was just like, 5 miles? Do they have lifeguards the whole way? Because I would need that. I don't think I would make it. So
yeah,
I'm out. But the marathon made me think of that, and I was like, oh man, jeez, that would take a long time to train for.
Yeah, I don't know if that's in my near future.
Probably not, but whatever. What is the best recovery story that you've had from physical therapy, whether it's someone you've worked with or someone that you know of?
I've had I mean, the good thing about where the setting of physical therapy that I work in an outpatient setting, you see a lot of recovery. There's other settings where you might not see a ton of recovery, and it's difficult. Their job is extremely important to those patients. But in outpatient settings, you tend to see a good amount of recovery. I have so probably the biggest transformation was I had a patient who had he had low back pain with radiculopathy. So he was lifting a heavy object. He was at work. It wasn't at the gym, but he was lifting a heavy object, and he herniated a disc. And I don't like to harp on disc. We can have a conversation another day, but just because it's people think that discs are causing their pain, and most of the time they're not. He happened to have a full blowout, so
the disc came totally out, or it just like broke?
So the inner portion of the disc, the nucleus pulposus, if the disc happens to tear on its outer edge, it'll start to press out, and then impinge on a nerve, and that's what was happening. A lot of people have slight bulges in their back, and that's completely normal. But when you have some back pain and you get ordered an MRI, you freak out because you have some bulging here and there, and you think you have to have surgery to cut it off and throw it in the garbage or whatever, whatever they do with it.
Yeah.
But he happened to have a very severe, a severe case. And those are the cases where you start to lose muscular function in your leg, the drop foot, so the inability to lift up your foot when you're walking, bowel and bladder changes. Those are red flags. Those are things that, you might want to maybe wait. I wouldn't even suggest waiting, but they potentially could get better, but for the most part, those are the ones that you need to have surgery and clean it up. So he had the surgery, and surgery was a success, but he happened to have contracted an infection in his low back, and it's called discitis. So essentially inflammation of the disc, but it's a much more severe case. It's a bacterial infection that'll work its way into the disc that was around. And the way the patient described it to me, he said that he was still in the hospital when this happened. He said he felt like a bomb went off in his low back. He was on morphine, did nothing for the pain. So it was like he went on a high from the back being repaired and feeling great, and then it happened to, get infected. And so that, long story short, he wound up coming to rehab. When he came in, he was and this gentleman is in his 30s, healthy individual, super athletic, baseball player, just someone you would never think that this would happen to. And he came in a walker, maybe was able to tolerate a minute of walking at a time before he had to sit or collapse. And that's where he started. And then we treated him for probably about 6 months, and, took him all the way through until he was running again, deadlifting, squats, kettlebell swings, anything. He was, and then I still see him today once in a while. He's doing great. So that was probably the most, life-changing one.
How long did that whole process take?
So that, he's honestly probably still going through it, and might always have to address it somehow, whether it's, we call it like back hygiene. So, stretching, doing your physical therapy type exercises. So, activating your core and, things that most people don't do in the gym, and I'm not generalizing, but, just
no, you're right.
Yeah.
No, no one does that.
No one does
maybe
that.
A few people.
No one should do that. You're weird if you're doing
a few people do that because they've probably experienced something.
Exactly.
And someone's like, "You better do this, or you're going to be really screwed soon."
Right.
And that's why they do it. Which we all should do it, but
right.
we don't kind of do it. Did you help him recover through excuse me, the basic approach of strengthen the core and typical like PT stuff?
It was, I mean, because of where he was starting and the amount of pain that he was coming in and the amount of disability he was coming in with, in the beginning it was just a matter of kind of desensitizing his system however we could. And sometimes he'd feel better sitting, sometimes he'd feel better lying down on his stomach, sometimes on his back. A lot of the beginning was just getting him to walk. So I wasn't even concerned about the back. I was just like, I have to get this man walking again, or else he's going to, he's not going to be able to function. Once that initial, and I think that, that beginning part may have lasted, 2 months, 3 months. It was a huge shock. Once he was able to start, looking like a, typical patient that comes in, after a, common low back pain kind of thing, then we started to work on activating the core again and, different positions, quadruped, kneeling, sitting, all these functional positions that we have to be able to do. And then slowly just continue to build. So, like I said, eventually we started doing deadlift variations. And the way that I start deadlifts is I usually have them pulling. I like the kettlebell. You could use a dumbbell. You could use a barbell. Depends on how comfortable they are, how much experience they have with it. But for someone who has no experience, I tend to like the kettlebell, just because it can fit nicely in the hands, and then it can, as you're doing the deadlift, you can kind of guide it between your knees and go straight down. So I'll have them tap an elevated platform underneath them, so they're not going all the way down to the ground. So they're basically doing a partial deadlift.
Sure. So for those who don't know, just to clarify, if you're really kind of 101 here, the deadlift, we're gonna put it in like dummy terms, is basically picking something up from the floor, but you're hinging at your hips. There's a slight knee bend. You want to use kind of your posterior chain going on, so everything that's on your backside. And when Chris is talking about the kettlebell and it being between the knees, so the purpose of that is when that weight gets, and this goes for life when you pick things up, the closer it is to you, it's a leverage thing. So when that kettlebell or I don't know, grocery bag or whatever you're picking up from the floor,
baby, whatever.
Yeah, baby, yeah. Picking up the babies from the floor, all that stuff. When they're inches away, that ends up being pounds. Adds up being pounds on, especially if you're not in the right position, right on your low back, where you're gonna end up messing yourself up. So that's kind of what he's talking about with the kettlebell, right? So you can keep it almost like right under you. So it's really not even much of a stress on the backside too much.
Exactly.
So that's just to clarify that. So I want to talk to you about the mental state of injury and people that you see in there, especially not like this individual, but it's a good example, because if someone comes in and they're having a hard time walking, that is, especially if they're an athlete previously, that is like depressing. That can be seriously just concerning, especially if that's like a passion or a love of theirs. But just in general, everyone who has to rely on, I'm never going to be the way I was again, or this is how it is, and I'm going to give this up. So you see that. I mean, you see that a lot, because when people are in physical therapy, they need it. They're there because they're in bad shape. And so with that bad shape, not everyone is happy-go-lucky. So are you guys trained in the psychology of it? Do you kind of just have to do your job? And I mean, I'm sure it's not pleasant to work with someone who's grumpy. Not that you can make everyone happy, but right. What's your kind of approach to people who are down and bummed, or maybe don't even want to come, type situations?
Yeah. No, I mean, so in grad school we took psychosocial, and that was probably, and then leading up to that, psychology, and but really, I think grads, and I think the trend is going in that direction. There's a lot more research, and there's a lot more knowledge that we have on pain science, and really looking at the individual and what's going on through their mind, through their through their entire body, and that's something that if you don't think that that's going to be a skill of yours in physical therapy, or if you're, or a trainer, that has to be a skill of yours, because you are, every single interaction you have with that patient or that client, from the first moment you walk in the door to, bring him into the gym or bring him into the physical therapy clinic, that psychosocial, that motor component begins. And, when we have patients who are, something's taken away from them, whether that's the ability to walk or the ability to play soccer or swim or play with their, grandchildren, it's, it's tough. And it's definitely something that I think the better clinicians are the ones that are able to screen that out from the beginning and just kind of recognize that, hey, this person is probably going to be, we're going to have to kind of work with them a little bit more. We're going to have to, talk with them, have some deeper conversations, maybe ease into exercises and, that kind of stuff, more patient education. But that's definitely, such an important role in getting someone better, is getting their mind right and getting them to, focus and motivated to get better. Because you're right, there's times where you feel like something's, taken away from you and it's never going to come back. And sometimes it doesn't, if you have a severe injury, like a, spinal cord or, traumatic brain injury or anything like that. And that's, those are the tough ones. But regardless of the situation, our job is to continue to motivate them and get them to, get them to do whatever they can at their highest ability, and if that's just walking or if that's getting back to running, then, that's our job.
Yeah. I mean, it's definitely tough. It's definitely tough. 'Cause I've been in kind of the, that downside where you're injured and you can't do anything. And it's just like, it's just horrible. Yeah. It's horrible.
Yeah. We're built to move.
Yeah. Now my approach cause I'm, for the most part, working with healthy people or people who are cleared for exercise, right? So you kind of have to do certain things to get people better. So my question is, the tough love technique, okay, of like, I don't want to do this. Oh, this hurts. Now for me,
that never happens.
Yeah. I don't necessarily have to make people do things, like, because there's so many different ways to get maybe a certain result. If it's like, all right, the goal for this person is to get their heart rate up. And if they hate doing one exercise and they like doing another exercise and they both get their heart rate up, then like, whatever, we'll go with that exercise. Right. And usually, you want to build a little rapport with the person before you're like, shut up, like do the row. I don't like, you got to do 3 sets. Like, I don't care. Like, oh, can we do 2 sets if I do 2 more reps? Like, no, like, stop, just do the exercise. So, now you have to, sometimes you're what can feel like torturing people, with certain techniques or whatever, and they have to do it. Do you ever find yourself being like this has to happen, or like, no, it's okay? Because there's a fine line when you're trying to gain back range of motion and break through scar tissue. Right. Because I'm not gonna lie, I've cried twice in physical therapy. Once when I was like 12 or 13, and the other one I was like 19, 20. So they made me cry, and it hurt like heck. And I knew it's. I mean, when I was 12, 13, I didn't know it was for the benefit. I'm like, you gotta be kidding me! Get me the heck out of here! I'm not doing that again. But what's your approach when you see people like that and you have to do that?
Yeah, I mean, make no mistake about it. Anything in healthcare or fitness, it's number one, especially with Yelp and media and all that stuff. It's all about customer service, and even without the social media stuff, it's really is customer service. So there is that element of kind of give and take kind of thing where you kind of have to be able to judge how much you can push someone. But I have at this point I have no problem sitting someone down, whether I think they're gonna go to my boss and scream about me or not. If I believe that I am going to give you an exercise or, a stretch that is going to help you or prevent that scar tissue from forming, like, if, our patients with knee replacements, I'm going to sit you down and explain and say, listen, if we don't get this done, then you're not walking, you're not going to get back to your full potential. So there's different techniques. And I think, again, that's where, the more experienced clinician comes in and is able to, find those little motivators, the little, carrot dangling at the end of the treadmill, that you kind of have to, figure out how to get through to people. But yeah, it's interesting because people come into physical therapy to get rid of their pain, and a lot of times they're leaving with a way more pain than they walked in with. And it's hard, but again, it comes down to, patient education. Explain to them, listen, this soreness is normal. It's, your muscles are adapting, your body, however you want to explain it, muscles have to break down to build back up, whatever it is. But the more you educate them, the more explain to them, most people will, buy into it and listen. But occasionally you get a couple of complaints to my boss, but that's all right.
Yeah, definitely. Well, I think, and I know like people would disagree with this, but the more I do it, because obviously there's a science to what you can, what someone can tolerate and what's the proper way to build up and do this or that. But when you start combining that with the psychological aspect, does the person trust you? The frequency, how they're feeling. A lot of people will say like the weather bothers, certain things. And it's like, it almost becomes like an art form, to be honest, to juggle all those things to still get them their result.
Yeah.
And to be efficient with it's pretty tough. But, the last thing I want to ask you about, kind of just strictly physical therapy is what is the most, when someone comes in and you're like, oh man, like they got this, who's got the patient with that? Like, what is the most difficult, injury or rehab process? I'm not to say it's not curable, like something that's not like, just something that's the most challenging. Like, this is going to be a challenging process to get this person to where they need to be.
Right. Now that you there's two injuries that are kind of in the back of my mind right now, but one of them are your patients with bilateral plantar fasciitis. So for those who don't know, both feet have pain in the bottom of your feet, in the bottom of your arches. It's super difficult to treat because it takes a long time to get better. Most of the time it builds over time, and there's a lot of things that people can do preventatively to help the build up. But anything in the foot and ankle are tough because you're constantly putting weight on your feet. And then let's say your one foot is really, hurt, and you wind up taking all the weight off of it. Well, then your muscles start to atrophy, and then all these other problems happen. So it's kind of a, lose-lose situation. But that's one of the tougher ones. But probably the toughest one, I think, and I think it's because of that trust barrier that you have with your patient is patients with neck pain. The neck is just again, I know it to be a very strong structure, but a lot of people think it to be a very sensitive structure because of the proximity of, the neck to the head, the occurrences of a lot of people get headaches with neck pain. A lot of people will tend to have, anxiety because they're just, even if they've done studies where if you just turn your eyes from side to side, you can activate small muscles in the back of your neck. So it is that sensitive. But I think it's difficult because you're trying to get someone to, basically calm down their system so that you can, either pick up their head and start doing some traction or stretch it or do some, exercises, start strengthening all those tiny little muscles in the neck. And it's, they're tough, but once you get a handle of it and you get better at explaining, what's going on, it eases it. But
that's crazy. Yeah, there's this guy, Louis Simmons is his name, who like founded Westside Barbell, which is like one of the, I guess you could say, hardcore or most known like powerlifting groups.
Yeah.
And he broke his back and had some neck injuries, and he kind of somewhat I don't know if he invented it or he just patented the machine of the reverse hyperextension. And then he looks like a crazy man, but he has a harness around his head, and he does like literally neck workouts and stuff like that. It's just crazy. I mean, you can't knock it because it's like he researched it and he literally fixed himself. So it's just crazy though. But it's super sketchy. You wouldn't think like, I'm gonna put something on my head and do a neck exercise.
It's
and
hard for people to buy into that.
Yeah, but I mean, someone might seriously mess themselves up doing that. But it's just kind of about the guidance, and if you know what you're doing, what you're trying to activate, then you can go from there. Just because you mentioned the foot was the hardest injury, I figured I might as well tell people, since I said I cried in physical therapy. The second time when I was older, 19, 20. I say 19. That sounds like a year, but when I was I don't remember if I was 19 or if I was 20. But it was for an ankle injury, oddly enough, because I think I broke my ankle, and then I had sprained my ankle, and then it was a continuous thing for 4 to 5 years. I had to deal with that. So it could never get better. And then it was a whole thing of like, well, maybe your calf is tight too, so now your ankle's not moving. And then it had to do with my big toe. So my big toe had an issue. I knew that a long time ago because I was getting calluses on the side of my foot. So something like the flexion of my big toe. I don't think there's anything that I could really do about it because I think it was in the joint. But they're like, well, we're gonna work on your arch, right by your big toe. And they took, what is it, the Grassin?
Grassin is one of the brands of the the metal,
you want to explain what Grassin is?
So it's I guess the formal term of it is it's a instrument assisted soft tissue mobilization. So I'm sure a lot of people have seen it. They come in all shapes and sizes, but it kind of basically looks like a butter knife. There's other shapes. Some of them look like ninja stars, which are pretty cool. And you're basically using that instrument in place of your hands or your knuckles to kind of work at the soft tissue or at the fascia. And it's just it's just a little more aggressive of an approach, which we use. I like it. It saves my hands, but
AKA scraping the bottom of my foot with pretty much a knife. Okay, I mean, not that it was a sharp knife, but right under my toe. I cried. It was unbearable. I was like, "Are you?" I looked like I was like, "You can't be serious right now. We're not seriously going to scrape the bottom of my foot again." No, this is
I do it all the time to patients. I would never let anyone do that to me. It's terrifying.
It was so brutal. And I at least I understood the concept at that point. I was like, all right, this is breakdown. It's to loosen it up so my toe will move. But I was like, forget it. I'll deal with the ankle pain. It was so bad. I was like, I can't handle it.
So they got you better. They got you to figure out how to use your mind to get better.
I guess so. But it's such a tricky thing with and this will kind of segue into the next thing, but well, the other time, it was also Grassin. It's Grassin, right? Or Grace? Mm-hmm. Grassin, yeah. So when I had a knee injury, which also I don't think could really be helped by that, it was Osgood-Schlager's. So it's not really an injury. It's a condition, I guess you could say.
It's that separation of the tibial tuberosity, where the tibial tuberosity is right at the top of your shin, right below your kneecap. There's a little bony prominence you could touch, and it's right where your patellar tendon attaches to, so it starts to kind of pull up.
So I got just a giant bump there, which sucks because maybe I could have been like an inch or two taller had I not had that. But anyway, so it hurt. It hurt a lot when I was growing, around, especially around 12 years old, 13 years old. And the guy was doing it on. This was kind of new. I'd never seen it before at this point, and he's doing it on my quad. Right above my knee, which is a common place for sure. But I don't. Now that I think about it, now that I know things, I don't think that really would have helped. I mean, I guess it can help my knee range of motion, but I don't know if there was ever going to be anything to kind of alleviate that.
Yeah, pain. I mean that's just a difficult. Any of the growth plate injury type things. So it can happen in different joints in your body. the knee is one of the most common. It's very difficult to treat, and really, I feel like the answer is you got to wait for the growth period to kind of come to an end.
That was just a hard period where I had to choose. Like, I only had an hour of activity a day, pretty much. It was like, which sport do you want to do today?
Yeah.
What do you want to practice?
Yeah.
What game do you want to play? I had to pick and choose because once it started hurting, it was over.
Right.
And eventually it passed, and now it's just a bump, and it's fine. But yeah, he was scraping my quad with that thing, and I couldn't take it. I was a young kid, and I was like, what is this guy doing?
I'm out of here.
Yeah, it was insane. So let's switch over now to kind of my favorite thing, which is working out, exercising, and all that good stuff. So we'll start general, because a lot of people have shoulder, low back, and knee pain, especially people that you see. A little, maybe it's slightly. I have a little low back pain. I love the people that I work with who like forget to tell me until we do it next. We'll do the whole assessment. I'll ask them good questions and stuff, and all that stuff. And that's kind of how you can pick and if your trainer's not doing a good screening, like you might want to be a little cautious about that. Probably goes the same for PT, because I know some people go to physical therapy in one place and like it sucked, I'm not better, and they go somewhere else and like this is the greatest thing that's ever happened to me. Right. So that's both approaches, I think, and just just caring, I guess you could say, come down to. So every time I work with someone and then we do an exercise, and like, oh yeah, I forgot to tell you, my shoulder pops all the time when I do this or that, or my low back hurts when I do them. Like, all right, so you got to go.
Or like my patients tell me halfway through the session, by the way, I fell down my stairs today.
Yeah.
Like, oh,
yeah, just like just throw something at you. The show must go on though, and you work through it. But what do you recommend for people? Let's just talk general. Someone's working out, they either have low back pain, they have shoulder pain, or they have knee pain, which I know is a lot of stuff to throw at you at once. But what are some things?
Deadlifts.
What are some things that you recommend? Do you recommend they avoid certain things? Like when you're first starting out, do you recommend like you should do this to strengthen this, or what's kind of your general approach? I know that's a loaded question, but just break it down however you want.
I guess if I take it into body parts, I guess I could start with I'll start with the back, I suppose, since it's the back is involved in every single exercise, your core and all that. But yeah, and again, it all depends on what stage of recovery they are, or if they've already gone through physical therapy and they're ready for working out. But even again, that example I gave before about high school football player who very muscular but has no core strength. Even trainers out there, just take your time to really assess the core and make sure they're able to activate it properly in all different positions before you load them up. But I would definitely, for the back, you want to always is, I don't like to use the word always, but having a neutral spine. So making sure that if you are bending down to the ground, you're using primarily your knees and your hips. You're not bending or rounding your spine down, and that goes for when you're in the middle of doing the exercise and when you go to put the dumbbell down or the plate back. I see that all the time, that people will start, they'll get into position, they'll do the exercise properly. They'll say it's just like bicep curls, and they have good posture and all that. And then on the last rep, they just round their spine, drop the dumbbells to the ground, and it's like, what did you do all that preparation for if you're just gonna, take the risk of,
Yeah, that's funny how people will pick up weight or put down weight at the end of the exercise with just like carelessness.
Terrible.
But then maybe they even do the exercise like perfect.
Yeah.
It's that's crazy. And well, just to kind of to speak on that point, one thing that happens to me, I don't know if you see it in some of your patients or your clients, but people, when they're trying to keep a neutral spine, they don't know what it feels like. So they're looking in a mirror. Yeah. And then all of a sudden, like now their neck is twisted, and they have a load in their hand, and they're bending down. So it's like it's almost worse. Like, how am I gonna know my back is straight? So what do you typically do in that?
I mean, well, now that we have technology, I guess, everyone's whipping out their cell phones at the gym anyway. So, that it is a good tool, if you could record yourself doing the exercise with your, with your head straight and your, but those types of things, if you're not able to attain or maintain a neutral spine, it's one of those, indications that you really need to dedicate time to, whether it's at home or at the gym, after or before your activity, go to the stretching area and just work on those, typical, physical therapy type exercises, where you're, doing your pelvic tilts or doing a cat and camel kind of thing, or use that session with your trainer to let them educate you on what is a neutral spine, how do you keep it, because eventually the better you get at it, the less you have to look at it. You don't have to look at the mirror anymore. You just know what it feels like, and like you said, people don't know what it feels like. So for trainers and PTs, it's all about cueing them. I feel like sometimes I don't know if it's just like a mental block or we think that we're going to offend the person by correcting their form, but that's why they're coming to see you. So if that first session you only do one exercise and you have to correct their form a billion times, then do it, because if they're picking up bad habits from the beginning, then it's just going to set them up for failure at the end.
Yeah, for sure. Not to cut you off with the shoulder and knee, because we definitely got to get to those, but the neutral spine, just so many things come up with that. And the first is like, one thing I hear a lot is, oh, I feel like as soon as I get to this weight, like my back's rounding. That's why I'm looking in the mirror. And it's like, it kind of goes back to what you're saying. Let's just take it to square one. Know what it feels like when your back is good. Know what it feels like when it's rounding.
Right.
And if you feel it rounding, you got to lighten the load and get stronger under those circumstances with the neutral spine. The other thing is cueing. So, I mean, this goes for so many exercises, whether it's like an overhead press, even as basic as a push-up, deadlifts, squats. You will hear a lot of things about where your head should be. You hear a lot of stuff about look up, chest up, no head down, no head neutral, where should your head be when you're doing push-ups, and things like that. I know I have my answers, but I'm kind of curious to hear, what your approach is, or if you cue somebody, what do you tell them?
I think for most people who are beginners out there, or just have never had anyone correct their posture or have done a postural assessment with them before, I think it's always safe to at least just align the spine. So for the head and neck, whether you're in a push-up position or standing looking in the mirror, you wanna keep your head in line with your spine. So that's where the chin tuck comes in, or the cervical retraction. Kind of that double chin kind of sensation. But that's step number one. And you really have to kind of look at every single joint, but it's easier to just either look from the bottom up or top to down. But then you're looking at their more so then you're looking at your shoulders. So making sure that their shoulders are retracted, they're not rounded forward, that their shoulders are not, elevating up or shrugging towards their ears. They're keeping them kind of down and back. When it comes to, now we're getting down towards the stomach and low back, are they, is their butt sticking out? Do they have like a big arch in their back? Or are they the opposite? Are they like way too rounded? Is their low back rounding the opposite direction? So that's where it comes into play with, having that co-contraction of your abdominals and your glutes to kind of, front and back support the spine. But at the end of the day, and I know we have more stuff to talk about, but every posture, it's like their DNA. Every person is going to have a different posture. Start them with the basics and align them properly. As they get advanced, they'll start to kind of figure out what works best for them. And as long as they're not causing injury and they're not doing anything crazy, then posture is very subjective, I suppose.
Yeah. So when I first see somebody, when they're going to squat, we'll say, because you took. Oh, actually, so what's your answer for the push-up? Where's the head?
The head I would
Or is it
have.
dependent?
So I would have you looking straight down at the ground.
Okay.
So your chin is tucked. You're not tilting your head back.
Chin
Looking
tucked,
forward.
meaning like you're trying to touch
Yeah,
your.
not like you're not. Yeah, you're not like squeezing your chin to your chest. You're in alignment. If I were to
Gotcha.
draw a straight line from the back of your head to your heels, it's a straight line.
Perfect.
Yeah.
That's a good answer.
Yeah.
So
Any other answer is wrong out there.
when you go to when you go to squat, when I assess somebody in the squat, because this is no load, keep in mind, I usually just let them do it.
Right.
I let them do it.
Right.
And then we go from there, because I don't tell certain people chest up. I don't tell certain people heads up, because sometimes I tell someone head down. Sometimes not down.
Right.
But them looking up sometimes creates an arch in their back,
Exactly.
or in their spine. And while they think, oh no, this is going to help me keep my back straight, it's overcompensating.
Right.
And then you get people who lift, same with the chest. You lift the chest up. But then there's people who you say right away, you say chest up, and boom, their shoulders go back, the neutral spine comes into play, and it's perfect. There's someone like me who I do better looking angled kind of down,
Right.
and that keeps my neck and my spine perfect. There's other people who when I first this is like when I first got to the gym, like one of my first years ever working out, and I was working out with rest in peace Big Eric, and he was teaching me like a powerlifting squat. So like keep in mind,
all different.
It totally is.
Yeah.
The goal of that is like you want to be smart and look through it, but the goal of that is to move as much weight as possible.
Exactly.
So it's not exactly for longevity purposes, if you will. I mean, there's research behind it and all that stuff, but he's like, look, keep your head up. Like, you got to look at the top of that mirror.
Because you're trying to create as much tension through your body as possible. You're trying to lock out every single...
And you do want to be tight and all that stuff, but like for me, that was causing a different issue.
Yeah.
So it is very individualized by the person. So I think people should just keep that in mind, because that's something that a lot of people ask. Like, when I squat, should my chest be up? Should I be looking up? Should I be looking down? And it's whatever's going to keep that neutral line through the spine. And that doesn't mean upright. A lot of people, that's also a big thing. Like, people think I got to have a straight back. Doesn't necessarily mean straight up and down.
Right.
Like, you can hinge at your hips. It's just like the rounding that we start to get concerned about. And then when you have multiple different angles at different joints,
it really comes down to the flexibility of the legs and specifically the congruency of your hip joint. So there's some people that have extremely flexible hips. They drop down straight to the ground. Their chest is up. Their back is completely straight. And then there's other people. And you can kind of guess on different parts of the world. But there's other people where the hips are just very, very tight and your body tends to kind of tilt forward. So you're right. In essence, you have to do what your body is kind of allowing you to do. If you can't be straight up and down like others, then you can't. It's fine. It's fine. And that doesn't mean don't do your flexibility and mobility training and stuff like that, and foam roll the hell out of your IT bands and whatever. But it's got to be natural.
Have you ever been like to, or just out of the country, I should say, out of America?
Yes.
You ever have to use a toilet that's on the floor?
No, I haven't. I knew you were getting there, though. I knew that just the way you were looking at me.
Yeah, it was just the first time I saw that, I was like, "Oh my gosh, that's a workout,"
But it was probably the best poop you've ever had.
Could be.
It all comes out.
That's what the whole thing about the squatty potty.
The squatty potty, that's right.
With the feet up and get that neutral spine, everything floats right out.
Oh yeah,
no impingement. So let's move on to the shoulders, and then we'll talk about
Speaking
the
of poop.
So when let's start with someone who has a shoulder injury, and then we'll talk about just what you can do to keep it kind of fresh if you don't. So someone has shoulder pain. A lot of people just instantly say, a lot of people turn to rotator cuff and then a bicep issue.
Yeah.
Whether it's like bicep tendonitis or something or whatever is attaching up into the
impingement,
shoulder area. Yeah. So what do you do? What are workouts that you say stay clear from, or that you should definitely be doing if you have those issues?
If they actively have, or they're actively dealing with an issue, and they have a rotator cuff, either a rotator cuff tear or rotator cuff repair, something like that. There are certain things, and again, it's all, it all comes down to the individual, but there's certain things like, choosing to do chest press or chest work with dumbbells versus a bench press, or doing dumbbell or bench press from flat on the floor. So there are certain things that are kind of common practice or common guidelines to prevent that. Anything overhead that's heavy. Some people can't do overhead at all. I don't like to automatically recommend to everyone not to do overhead, because there's a right way of doing it, and I think that in our everyday life we have to reach up, we have to place our bag into the overhead compartment, and maybe that's just once or twice a year, but still you should be able to lift things up overhead and lift things up and put them down. Yeah. Those are kind of like my initial recommendations. Doing a lot of pulling movements is something that I would recommend them do. Just because in most people, if you're an American, you probably have poor posture. I'm just going to say it, but sure. Especially if you're sitting at a desk or for long hours, everything in our life is in front of us, so we're automatically going to overuse all of our front muscles, our anterior muscles. So, eating, drinking, driving, not drinking and driving, but
I hate it when I'm tight from drinking and driving.
Oh God, terrible.
Please don't drink and drive.
Yeah, yeah. Texting, so we're naturally going to overuse all of our anterior muscles or our front muscles. So I usually recommend to people to do some extra pulling movements. So, that's hitting your back, row machine, doing different variations, different angles of the row. I like the, single arm row from the bench. I like, but still do some chest work, do some pushing movements, but maybe, in the beginning, until you start to get comfortable and you start to get stronger, maybe stick to like a 2-to-1 ratio. So for every one pushing, do 2 pulling, kind of thing.
Yeah.
But
awesome.
Yeah.
And now let's move on to the knees. Let's start with something like a specific injury. So let's say someone's had an ACL repair or a meniscus tear, or some type of major operation where they have a repaired knee. Is there any type of exercises that you would definitely recommend, stay away from, or also talking about the load, would you say that you train in the same way that you normally would with progressive overload, or should you just keep it kind of mobile and that's it?
It's interesting because a lot of there's been a lot of recent research and a big push, I think, from like the physical therapy community to load your patients more, to do, get away from the 3 sets of 10 or the 30 reps, and start to, go towards 6 reps, 5 reps, 4 reps. And the reason is because research is backing it up a lot of times. So I tend to like closed chain activities for when it comes to the knee. So closed chain is when you are basically secured from the top and bottom. So a leg press, your foot is in contact with the plate, and then your back is supported by the back support. An open chain exercise, which is going to be the opposite, is something like the knee extension machine or the hamstring machine, which I use those machines. I don't have a problem with. I know some people say never do the knee extension machine where you're kicking out the weight.
Yeah, I think not to interrupt you. I think I told you one time that there's this guy who I did see the other day. I don't know his name. I'm sure he's a nice guy, but he's been wearing the same outfit, like the same T-shirt, light blue T-shirt to the gym.
Red flag.
For like since I've been there, so like 6 years. The guy's been wearing the same workout T-shirt. which bothers me, but I mean, whatever, as long as it gets it done. But he actually came up to me one time when I was on the leg extension machine and was like, I don't know, never talked to me in my life. And he just said, that's one of the worst exercises for your knee. That's what my doctor said. You shouldn't do it. But you don't understand. This guy was he was like waiting there for me to get off it. Like he was, not that he was going to use it. He was like, are you going to listen to me? Are you going to get off the machine? I'm like, I don't know what to tell you, man. Like, because for me, the leg I get it. The whole, like, I think it was a traction thing, like of it being lifted and then you're adding pressure, but
there's a lot of torque on the patella in particular.
Yeah. For me though, not that I ever went crazy heavy and always added load appropriately as we went on and build endurance, but that actually has been a machine that's helped my knee pain.
Yeah.
Drastically. Just the stretching and getting that muscle stronger just in an appropriate way has been amazing for me.
Right.
But I know that some people frown upon certain machines. So, I mean, and again, machines, they're great because they are closed chain. Then again, you got to make sure you're setting them up right because not everyone is built the same for the people who make the machines do the best they can, but
some people may never be able to do a machine properly because of their body type or the way they move, and that's something I think the better trainers, the better physical therapists out there will kind of recognize. And at the end of the day, people should be able to do body weight type movements before they start, properly before they start jumping on machines and racking up the weights and stuff. But we tend to rely on machines because, like you said, they're very secure. They kind of take your core out of the equation, so you can just focus on the movement or the muscle that you're trying to activate. But our everyday life does not work that way. We're not,
True.
Besides our cars, we're not sitting in machines, and we're walking, we're getting up, we're bending down, and
Yeah.
So you have to be able to do that properly.
Mm-hmm. My answer to everyone who always asks, because I mean, this has been a question since the beginning of machines, I guess you could say, is what machines versus free weights, and it's always that like, what's better? What should I do? And like, there's always been a lean towards free weights and body weight exercises just because of what you said. Yet at the same time, if you're trying to isolate something, or if you're recovering from an injury and you don't want to have to deal with the stability or any other variables going on, then a machine is great. Or like, maybe that machine, it does fit you perfectly. It could be the opposite. Yeah. It's like, this machine feels great and I feel it right where I need to, and it's going to help me develop this muscle, whatever it's for, strengthening, bodybuilding, anything. So that's cool. So basically the takeaway point for the knees is kind of start with, you want the stability, but start with closed chain exercises. Yeah,
closed chain. I don't have a problem with people if let's say we're doing squats. I don't have a problem with people going below 90 degrees of knee flexion when so basically going doing deep squats. But I tend to feel like for most individuals, stay around 90 degrees or above it, especially if you're dealing with injury, just because the compressive loads to the patella and just the knee joint in general, it gets higher the lower it gets down there. And then the other suggestion I would say is just slow eccentrics. So you should be able to lift that weight, whether it's the machine or free weight. You should be able to control it for let's say a 5-second eccentric load before you start loading up the weight and using your momentum to kind of bring it up and down. And I think that some people could go the rest of their lives just doing slow eccentrics. I think there's a whole movement out there, or has been in the past, of just doing the slow and controlled kind of thing, and people get excellent gains from it, and tends to be a little safer. You can still rack up the weight, but as long as you could control that weight with good form and you're not using momentum to swing that weight, I think you'll have excellent gains from that.
Yeah, that's a whole different subject.
Sorry
no, you're right. That's a horse of a different color.
I'm just forcing you to bring me on for
no,
another episode.
No, we're gonna have to bring you back. There's just too much stuff to talk about in those regards. But to wrap this little section up, I want you to give me your, let's say, either someone who's recovered or healthy. Let's say I want to go to the gym, and Chris said that I should do these exercises as a warm-up or a movement prep for my low back, my shoulders and my knees because I know that I have injuries or I don't want injuries. So what are some of your go-to warm-up exercises or activation moves that you teach either in PT or with personal training clients?
Right. I definitely, a warm up of some sort, whether it's treadmill, bike, row machine. I tend to just to kind of don't think of that as your workout per se. Just think of it as a time where you're getting your heart rate up and you're just getting your body a little warmer. If I know that I'm going to be training my legs, or if I have a patient that's we're working on their knee or their hip, I will definitely tend to do more focus on a bike, resistant bike, or Stairmaster or something like that, where we're getting a lot more direct blood flow to the legs. So if you're working your arms, if you happen to have an arm bicycle or a row machine, I would kind of skew more towards that side. But that being said, the initial warm up is really just to kind of get the heart rate up and get the body warm. If you want to take it a little further, I with my athletes, I love to do dynamic warm-ups. So, not to spend so much time on it, but basically, if anyone's who's played high school or collegiate sports, it's that warm-up where you're kind of going back and forth across the field and warming up the hamstrings, the quads, doing lunge variations, doing skip variations, just any type of movement you might need for that sport or that movement, you're trying to kind of elicit that response from the body. But if if that's not something that you'd want, and I'm not suggesting that for every single person. If you're gonna go in and let's say you're gonna work your back, I definitely would recommend ramping up. So whether that's if you're about to go do lat pull downs, then try to activate your lats somehow. So whether that's simple as that. But
I get it, because I'm thinking when I first started to do bodybuilding competitions, I was like, I don't want to say this was wrong, but I looked like an idiot for sure. When I was walking on the treadmill, I would be flexing, not like all out, like who's that guy flexing on the treadmill, but like I was like lift up my torso and try to spread my lats and kind of contract my scapula back and forth. It was like a total mind, muscle, mental preparation. It looks just so stupid. That's but
I've seen a lot worse than
this. Yeah, true. Yeah, I'm not gonna. It's not the worst thing ever, but I did used to do silly things like that.
Yeah.
So that's kind of good knees and back. Do you have anything specific for shoulder warm up?
I like to incorporate some band work in the beginning. So we have this exercise that we do. It's called the Terrible Sixes. I don't know if maybe I could maybe in your show notes we could maybe jot down the different variations of it. But you're essentially taking a round TheraBand or resistant band, whether it's tied or it's one of those pre-circular ones, and you put it around your wrists. You put your arms out straight in front of you, and you start to do different pulses and different movements. So it's easier if I just write it down.
Sure, that's good. Yeah, we'll put that in there. And I recently saw, just kind of to go back to being smart when you're training, because if you do copy or try out this kind of warm up with the band, something to keep in mind is bands get harder as you pull them apart. So if you're talking about something like the shoulder, especially when you're warming it up or you have an injury already, and you're gonna do maybe the one goes out, is one of the moves like out.
Yeah, exactly.
All right, so maybe the one that moves is out, and it's gonna be at its hardest point when you're all the way out, and a muscle that you're trying to just warm up here and help. So you don't want to choose a heavy band on kind of, I don't want to say a weak muscle, but a very kind of an isolated movement on something that you're trying to warm up or heal.
Right.
And you don't want to.
This is not the working load. You're just using a light band to wake up the muscles.
Yeah, the band is just for resistance if you're going to use a band, because that gets hard quick. So it's important to pick kind of a good band, or just maybe go
a good movement.
Yeah, and go what you can handle. So I just wanted to make a note of that, because a lot of people do just grab bands and go gung-ho on, like whatever kind of crazy rotator cuff exercises.
Right.
And it's good to a degree, but you know, you could end up hurting yourself in the warm up.
Yeah, you could completely exhaust your, if you've never, done rotator cuff specific exercises, and all of a sudden you do, a ton of repetitions on it, and then you go into jump into, overhead press, you might irritate some things. So that, definitely.
Awesome.
So something to keep in mind.
What is your? I just want to ask you two personal questions.
Yeah.
What's your favorite exercise? Well, let's go start with that. What's your favorite exercise? What do you like to do?
I really like the Romanian deadlift. I think that it teaches the hip hinge most properly out of all the exercises. The deadlift, obviously, the regular deadlift, does the same. But no matter how many times I do it, my hamstrings are shot for the next 3 days. I can't do enough of it. But I think that it just it hits the posterior chain better than any exercise that I have, and I for me it just happens to be very effective. So awesome. That's one of my favorite.
Cool. And what is your favorite recovery thing that you do? Like whether that's like foam rolling or type of stretch or massage. Do you do something personally that you're like, I love doing this, or I have to do this, and it's a go-to for me?
Yeah, I guess, I couldn't say that there's one thing in particular, but I'll definitely try to throw some days into the week that are kind of like your, quote-unquote PT days. So whether that's, walking on the treadmill for, 30, 40 minutes just to kind of calm down the body. I love to stretch. I think that a lot of people don't finish their workout with stretching, and it's a shame because it really does help prevent injury, and it just puts your muscles in.
I'm so guilty of that.
I know.
It's sad.
Yeah.
It's
well, your physique wouldn't,
Yeah, but I remember just like, stretching. I get it now for sure. I mean, I always got it. Like it's not, I make people do it too. It's just something that ends up being lazy. But I hate to admit this, but it was really only until like maybe 2.5 years ago when I was training legs. I was training legs like so hard in this one competition prep. I don't know. I was just really pumped and focused. So I would train legs, and I was working in the city at the time, and I'd have to take the subway, and this was every Wednesday. And like going down the stairs, I dreaded it. It was like absolutely freaking awful.
Yeah.
Until one day, me and my buddy had to go to the same place. We had to take the same train, and we had a little time. And he's like, "Do you want me to?" Because we just went through a stretching seminar. He's like, "Do you want me to do these stretches on you?" I'm like, "Oh, my legs are killing me." I was almost so tired, like I didn't even want him to do it, but he did. It was just so basic. It was like a glute stretch, hamstring, quad, and hip flexor. That was it. Just like one stretch for each, and it was on a table.
Yeah.
And I didn't have to do anything. And the next day, I was still sore. I was crazy. You leg press 1,000 pounds, like you're going to be sore. Like there's no way around. No stretching is going to cure that. So we did, but I could move. It was amazing. Like just to go to sit down, like it still hurt when my butt hit the toilet or the chair or whatever, but I could do it. I wasn't moaning the whole way down. It was just like the impact. So man, it's really crazy.
Yeah.
And until you experience it, like the drastic of it, it's just you got to do it. So
my wife does yoga a lot, and once in a while she'll drag me to yoga. I like it. I do like it, but for me, I just have more passion in the gym and cardio and all that kind of stuff. But every time I go, I feel amazing. So it's definitely
all right. So we're gonna put yoga as your favorite recovery.
Then. Sure, let's do some yoga, some hot yoga.
You do hot yoga?
Hot Bikram yoga.
I don't know what that is.
There's a new Netflix documentary on it that shed some light on who Bikram was, and he was let's just say not the best kind of teacher.
Okay.
Too personal with his students.
Okay. I got
allegedly.
I understand. Well, listen, we're definitely gonna have to have you back because there's too much stuff to talk about in particular. Yeah. So maybe we'll break down a certain muscle group or a certain theory next time for sure. Because it's great to hear your perspective coming from more of the medical side and all the patients that you've seen, and then tie it in with personal training. Because everyone, whether they're a kid in high school or your 6-year-old, whatever, a lot of people end up in physical therapy these days, and then a lot of people end up in the gym,
Yeah,
whether
yeah.
it's through
Yeah.
weight loss or they're hurt or they graduated PT and it's
Yeah.
time to work out. So this was great stuff. And Chris is a physical therapist at Holy Name Medical Center, H&H Fitness. It's called. It used to be Holy Name Hospital, so it still goes by H&H Fitness, Holy Name Fitness. And you can find him on LinkedIn as well, Chris Cordero. And if you have any questions, you can email me or record at. You can email me at bsupremefit@gmail.com. Or if this platform has somewhere where you can comment, please ask any questions. Is it okay if people reach out to you?
Yeah, absolutely.
All right,
Yeah.
I got
Yeah.
you, man. I'll filter.
Yeah, yeah.
I'll filter the trolls or anything like
Yeah,
that. We'll be happy to ask Chris the questions next time we have him back. If you come back,
I will.
All right,
will.
cool. We got him.
Such a generous host.
All right, that's a wrap. Thanks for listening, and until the next time, take care.